Blood-borne pathogens are any disease-causing microorganisms, viruses, bacteria, etc., that may be present in human blood or other bodily fluids. There are numerous blood-borne pathogens. However, those of most concern to the modification practitioner are hepatitis C, hepatitis B virus, human immunodeficiency virus. Modification practitioners should also be aware of the following: tuberculosis, methicillin-resistant Staphylococcus aureus. Modes of transmission. Blood-borne pathogens are most often transmitted when infected blood or other potentially infectious material comes into contact with mucous membranes, eyes, nose, and mouth, or non-intact skin. Non-intact skin includes, but is not limited to, cuts, abrasions, burns, rashes, acne, hangnails, unhealed tattoos, unhealed piercings. Blood-borne pathogens can also be transmitted through splash or spray of contaminated liquid, handling of or contact with contaminated objects or surfaces, needle sticks, puncture wounds, or any injury which breaks the skin caused by a contaminated sharp. Standard precautions. Standard precautions are the most appropriate and preferred method of infection control for modification practitioners. Under standard precautions, the following are considered infectious: all blood, all other bodily fluids, secretions, and excretions, regardless of whether or not the blood is visible, non-intact skin, mucous membranes, dried blood, saliva, and any other bodily substances that are considered to be contaminated and/or infectious. It is recommended that standard precautions be followed for all instances of client care. Everyone is treated the same. There are no extra precautions.
Upon initial hire, all practitioners should receive training in studio-specific policies and procedures, blood-borne pathogens, infection control, sterilization, and hazard communication. Training should be updated at least annually and when necessary. An individual training and medical record should be created for each staff member. Training records document all initial and subsequent training each staff member receives. The practitioner reads all written protocol for the studio. The trainer demonstrates each task to the practitioner. The practitioner performs each task for the trainer. The practitioner is given the opportunity to ask questions. The trainer and practitioner sign off that training has been completed. The Occupational Safety and Health Administration requires annual training in the Blood-borne Pathogen Standard.
Posters like this one from Icon Device can help reinforce proper hand washing techniques for all practitioners and employees. Wet hands and wrists with warm running water. Apply a sufficient amount of soap to open palms. Move hands away from running water. Lather soap and scrub hands well, palm to palm. Wash hands well for about 20 seconds. Scrub in between and around fingers. Scrub back of each hand with palm of other hand. Scrub fingertips of each hand in opposite palm. Scrub each thumb clasped in the opposite hand. Scrub each wrist clasped in the opposite hand. Rinse thoroughly under running water. Wipe and dry hands well with paper towel. Always pat hands dry gently with a disposable paper towel. Roughly drying them can cause microabrasions and remove the top layer of your protective skin. Taking the time to thoroughly pat your hands dry will help prevent chapping and cracking of the skin. Turn off water with paper towel. Hand washing should be performed upon arriving at work, before gloving, after the removal of gloves, after contact with any potentially contaminated surface or item, after working in common areas or performing housekeeping duties, between direct contact with different clientele, before and after eating, drinking, or handling food, after personal use of toilet facilities, when hands are visibly soiled, including after sneezing, coughing, or blowing your nose, before leaving work, whenever necessary. Use sensible judgment.
Personal protective equipment, PPE, refers to the barrier equipment designed to minimize, reduce, or eliminate the risk of exposure to bloodborne pathogens. Examples of PPE used in the modification industry include disposable medical-grade exam gloves, disposable sleeves, disposable aprons, face and eye protection. Select PPE based on the type of exposure, the quantity of blood or OPIM which can be reasonably anticipated to be encountered during the performance of a task or procedure, the length of the procedure. PPE is considered appropriate only if it does not permit blood or OPIM to pass through to or reach the practitioner's skin, underlying garments, eyes, mouth, or other mucous membranes under normal conditions of use and for the duration of time that it will be used. All PPE must be removed and disposed of properly before leaving the immediate work area in order to prevent transmission of contaminants and possible cross-contamination. Pull first glove on completely. With gloved hand, remove the second glove from the container. Pull the second glove on completely. This procedure minimizes the bare-handed handling of the gloves. Pinch the cuff of the opposite glove. Pull the glove off completely, turning it inside out. Slide thumb of ungloved hand under remaining glove. Pull downward, turning glove inside out. Dispose of gloves. Single-use, medical-grade exam gloves should be worn routinely as a safety barrier for practitioners. OSHA requires that gloves be worn whenever there is a reasonable likelihood that hands will be in contact with blood or OPIM, mucous membranes, non-intact skin, contaminated items, or contaminated surfaces. While gloves offer important barrier protection, it is important to note that they are not completely impermeable. Friction, chemicals, and sweat can compromise the integrity of the glove. In addition, constant use of gloves may cause irritant dermatitis due to mechanical irritation from the glove powder, chemical processing agents, or from residual soap trapped between the glove and the skin. According to the bloodborne pathogens standard, hands must be washed immediately after gloves are removed and disposed of. Needle stick procedure. 1. Secure the needle. 2. Remove glove immediately. 3. Wash area for at least 1 minute using antimicrobial soap and warmed water. 4. Dry the area and bandage the wound. 5. Seek medical attention immediately. 6. Report incident and fill out appropriate paperwork. 7. Review the incident and evaluate what went wrong. If a garment becomes visibly contaminated with blood or OPIM, the item must be removed as soon as possible. Do not remove contaminated clothing in this manner. Shirts must be cut off to minimize the risk of exposure to eyes, nose, and mouth.
When cleaning or disinfecting equipment and surfaces, always wipe down from the highest to the lowest point. Wipe down door, mirror, etc. Clean sink and soap dispenser. Clean lamp and shelf items. Clean glove holders. Clean sharps containers. Clean workstation. Clean trash can.
Protective barriers are an essential method of infection control. Examples of barriers used in the modification industry include table paper, dental bibs, bottle bags, clipcord covers, machine covers. Cover cart with plastic and lap cloth. Cover armrest with lap cloth and secure with barrier film. Lay out disposables. Cover clipcord. Lay out disposable ink cups. Cover squirt bottles. Cover power supply and knob. Lay out needles, tubes, and machines. Purge the berry care tube. Apply berry care to cart. Fill rinse cup with distilled water. Apply petroleum jelly to cart. Secure ink cups with petroleum jelly. Fill disposable ink cups. Assemble needle, tube, and machine. Bag machine. Barriers used to cover equipment or any other surfaces must be removed at the end of each procedure or as soon as possible when they become contaminated. The underlying surface must then be properly cleaned and disinfected before a new barrier is applied.
Skin prep. Proper skin prep equals less chance of an infection equals less chance of a lawsuit. Tincture of green soap, Noxema, isopropyl alcohol, BZK, witch hazel, and Dr. Bronner's are not adequate skin preps. They do not have the bacterial reduction equivalent to a product that is meant to be used in procedures where the skin barrier is broken. Read up on MRSA. In addition, those manufacturers will not support or endorse the use of those products for use in a tattoo procedure. Use Technicare to prep skin. Technicare can also be used for shaving and stencil application. Before covering tattoo, apply a thin layer of berry care. To properly cover tattoo, use dry lock pads. Dry lock pads pull fluids away from the skin, which helps inhibit bacterial growth. Never use plastic wrap. Remove covers from bottles. Remove covers and tear down machines. Properly dispose of any biohazard materials.
Spray Prepzyme into the tube.
Place ink cups in rinse cup. Place paper towel in cup to soak up liquid. Properly dispose of all other hazardous materials. Clean and disinfect machines. Clean and disinfect workstation. Remove and dispose of cable cover.
Equipment such as clip cords, machine heads, foot pedals, power supply packs, sundry jars, procedure tables or chairs that come in contact with blood or OPIM must be cleaned and disinfected at the end of each procedure or whenever necessary. At the end of each shift, put on the appropriate PPE and retrieve equipment isolation tub from the work area. Be sure the isolation tub's lid is secure. Carefully transport the isolation container to the dirty side of the sterilization area. Place isolation container on the counter closest to the equipment processing sink. Initial rinse and scrub. The purpose of cleaning and rinsing is to remove all visible debris from an item and to reduce the number of particulates and microorganisms. Thorough cleaning and rinsing is vital to the effectiveness of subsequent processes used for decontamination, disinfection, and sterilization. Nitrile gloves are to be worn when processing contaminated instruments. Spray Prepzyme into the tube. Use a product like Miltex Instrument Stain Remover to scrub each tube. The outside of each tube should be scrubbed with a nylon bristle exterior tube brush. Thoroughly rinse equipment in the processing sink under warm, low-pressure running water to remove gross debris. Thoroughly inspect each tube for any remaining visible debris or stains. Carefully place equipment into the disinfectant basket. Do not overload the basket. Do not place dissimilar metals together in the basket. To reduce the risk of splashing contaminated liquid, gently lower the basket back into the disinfection tub. Make sure all equipment is fully submerged in the disinfectant solution and replace cover. Allow equipment to soak per the manufacturer's instructions. Most disinfectants require a contact time of 10 minutes. After proper length of time, remove lid from disinfectant bath. Slowly lift the enclosed basket out of the disinfectant tub. Rinse each piece of equipment under warm, low-pressure running water. Carefully place equipment into the ultrasonic basket. Replace disinfectant basket. To reduce risk of splashing contaminated liquid, gently place the ultrasonic basket back into the cleaner. Replace the lid. Allow equipment to run in the ultrasonic cleaner per the manufacturer's instructions, usually from 15 to 30 minutes. After cycle is complete, slowly lift basket out of ultrasonic cleaner. Allow excess fluid to drain from basket. Remove equipment and individually rinse each piece in the equipment processing sink under warm, low-pressure running water. Replace ultrasonic basket. Thoroughly dry equipment before further processing occurs. All equipment must be completely dry before packaging. Packaging is a generic term that includes all types of materials available that are designed to wrap, package, and contain reusable equipment and other single-use supplies for sterilization, storage, and aseptic presentation. An indicator strip containing the following information must be placed in each package. Description of the package contents, initials of the package assembler, lot control number, for example, the last 4 digits of the current spore test number, date of sterilization. Place indicator strip into package. It is essential to properly label packages before sterilization. Labeling is necessary not only for the practitioner, but also for quality assurance, stock rotation, and inventory control purposes. Package labels should include description of the package contents, initials of the package assembler, lot control number, for example, the last 4 digits of the current spore test number, date of sterilization. Tattoo tubes should be packaged with the tip end towards the open end of the package. It is important that all packages are sealed completely to ensure sterility. Self-sealing pouches should be sealed using the adhesive on the packaging and sterilization indicator tape. To ensure proper sterilization of equipment and to preserve the longevity of the autoclave, always follow the manufacturer's instructions for the specific make and model of autoclave you are using.
When cleaning or disinfecting equipment and surfaces, always wipe down from the highest to the lowest point. Wipe down door, walls, etc. Clean glove holders. Clean sink and soap dispenser. Clean tray, lamp, and table. Clean workstation. Clean items to be used on top of workstation. Clean trash can and sharps containers. Intermediate level disinfection is the preferred method of disinfection for tools, equipment, and work surfaces in the body modification industry. Intermediate level disinfectants kill vegetative microorganisms, Mycobacterium tuberculosis, fungi, lipid and non-lipid medium-sized and small viruses, but not necessarily bacterial spores. Remember, if it's not cleaned first, it cannot be disinfected.
Lay out and fill disposable cup with sterile water. Lay out disposable cup and dispense a few drops of gentian violet. Lay out sterilized needle and jewelry packages needed for procedure. Transfer cups of sterile water and gentian violet to workstation. Open sterilized piercing setup package and place on workstation. Verify indicator strip has turned black. Open sterilized needle package. Open sterilized jewelry package and place jewelry on tray. Retain indicator strips from piercing setup, needle, and jewelry packages. Apply small amount of Technicare to sterile open needle package. Skin prep. Proper skin prep equals less chance of an infection equals less chance of a lawsuit. Tincture of green soap, Noxzema, isopropyl alcohol, BZK, witch hazel, and Dr. Bronner's are not adequate skin preps. They do not have the bacterial reduction equivalent to a product meant for procedures in which the skin barrier is broken. Read up on MRSA. In addition, the manufacturers will not support or endorse the use of these products for use in piercing procedures. Use Technicare to clean and prep the area prior to piercing. Start at the center and wipe outward in a circle. Flip gauze and wipe further out in a circle. Flip again, cleaning as far out as your hands might lay on or touch the client. Use a sterile toothpick with gentian violet or a single-use gentian pen to mark the site of the piercing. Gentian violet is a mild antifungal agent which helps keep the entrance and exit site of the piercing as clean as possible. Use receiving tube or cork to receive cutting edge of needle to prevent needle stick before transferring jewelry. Transfer jewelry. If any blood is present, use a sterile cotton-tipped applicator to clean the area. Following these basic procedures can prevent a needle stick and the possibility of a lifelong disease. Use forceps to pick up needle and cork. Dispose of needle and cork. Wrap up tray contents. Dispose of wrapped contents in biohazard bin. Any equipment that comes in contact with blood or OPIM must be cleaned and disinfected at the end of each procedure or when necessary.
At the end of each shift, put on the appropriate PPE and retrieve equipment isolation tub from the work area. Be sure the isolation tub's lid is secure. Carefully transport the isolation container to the dirty side of the sterilization area. Place isolation container on the counter closest to the equipment processing sink. Initial rinse and scrub. The purpose of cleaning and rinsing is to remove all visible debris from an item and to reduce the number of particulates and microorganisms. Thorough cleaning and rinsing is vital to the effectiveness of subsequent processes used for decontamination, disinfection, and sterilization. Nitrile gloves are to be worn when processing contaminated instruments. Place basket from isolation tub into processing sink. Slowly lift the enclosed basket out of the disinfectant tub and place in processing sink. Thoroughly rinse equipment in the processing sink under warm, low-pressure running water to remove gross debris. Carefully place equipment into the disinfectant basket. Do not overload the basket. Do not place dissimilar metals together in the basket. All hinged instruments must be in the open position. To reduce the risk of splashing contaminated liquid, gently lower the basket back into the disinfection tub. Make sure all equipment is fully submerged in the disinfectant solution and replace cover. Allow equipment to soak per the manufacturer's instructions. Most disinfectants require a contact time of 10 minutes. After proper length of time, remove lid from disinfectant bath. Slowly lift the enclosed basket out of the disinfectant tub. Rinse each piece of equipment under warm, low-pressure running water. Carefully place equipment into the ultrasonic basket. Replace disinfectant basket. To reduce risk of splashing contaminated liquid, gently place the ultrasonic basket back into the cleaner. Replace the lid. Allow equipment to run in the ultrasonic cleaner per the manufacturer's instructions, usually from 15 to 30 minutes. After cycle is complete, slowly lift basket out of ultrasonic cleaner. Allow excess fluid to drain from basket. Remove equipment and individually rinse each piece in the equipment processing sink under warm, low-pressure running water. Replace ultrasonic basket. Thoroughly dry equipment before further processing occurs. All equipment must be completely dry before packaging. Piercing forceps and other hinged instruments should be lubricated with an appropriate product. Work hinges back and forth to allow lubricant to penetrate. Remove excess lubricating product by gently dabbing equipment with a clean, dry, lint-free towel. Packaging is a generic term that includes all types of materials available that are designed to wrap, package, and contain reusable equipment and other single-use supplies for sterilization, storage, and aseptic presentation. Place all items into the sterilization packages in the open position, if applicable. This allows steam from the sterilization process to permeate as much of the equipment surface as possible, promoting the full sterilization of the item. It is essential to properly label packages before sterilization. Labeling is necessary not only for the practitioner, but also for quality assurance, stock rotation, and inventory control purposes. Indicator strip should include description of the package contents, initials of the package assembler, lot control number. For example, the last 4 digits of the current spore test number, date of sterilization. Place indicator strip into package. It is important that all packages are sealed completely to ensure sterility. Package label should include description of the package contents, initials of the package assembler, lot control number. For example, the last 4 digits of the current spore test number, date of sterilization. An alternative method for packaging a piercing setup is to include all instruments with a labeled indicator strip and stainless steel tray wrapped in CSR wrap. Items wrapped in CSR wrap should be sealed using Autoclave indicator tape. To ensure proper sterilization of equipment and to preserve the longevity of the autoclave, always follow the manufacturer's instructions for the specific make and model of autoclave you are using. Sterilization is the process by which all forms of microbial life, including infectious bacteria, viruses, yeasts, mold, and bacterial spores, are destroyed. Steam under pressure is the preferred method of sterilization for the body modification industry. Sterilization is not to be confused with disinfection. It is important to remember that sterilization is a process. If each step that leads up to autoclaving are not performed, the actual sterilization process may be compromised. In order to attain terminal sterilization, the proper combination of time, temperature, pressure, and moisture saturation must be attained inside the autoclave. Monitoring the sterilization process. Quality control and consistency. Temperature gauge. The temperature of the sterilizer must be maintained to ensure that all organisms are killed, usually 274 degrees. The amount of time that the machine takes to reach this temperature must be added to the actual processing time. Pressure gauge. Pressure is necessary to raise the temperature of the water above the boiling point. Timer. The length of time necessary to complete the cycle depends on the item being processed and the type of packaging being used. Refer to the manufacturer's instructions to determine the appropriate cycle length. The standard is 274 degrees for 15 minutes. Moisture saturation. The steam in the autoclave must reach 100% relative humidity. Mechanical indicators provide an assessment of cycle conditions. Temperature gauges, pressure gauges, timers, and printouts are all examples of mechanical monitoring. They must be checked with each load to ensure that the parameters are being met and to ensure that the autoclave is functioning properly. Chemical monitoring. Chemical indicators and integrators are used to monitor the actual physical conditions inside the autoclave. They respond to the conditions via a characteristic color change. There are two distinct types of chemical indicators. Indicators are devices that respond to steam or moist heat. Often, the outside of the packaging will include an area that changes color. Special sterilization tape or chemical strips behave in a similar fashion. Indicator strips are designed for placement inside packages in order to show penetration of steam. Integrators are process indicators. They behave similarly to steam indicators in that they react to physical conditions via a color change. However, integrators are designed to respond to more than one required parameter of sterilization. Although different brands will vary, integrators go one step further in terms of parameter monitoring. Integrators must be subjected to the same conditions, packaging, etc., as the equipment being processed. All tattoo and piercing equipment, jewelry, and supplies that are to be autoclaved must contain an internal steam indicator strip inside of each package. All indicator strips must contain the following information: date the equipment was packaged, initials of the employee who is packaging the equipment, the code for the piece of equipment being packaged, last 4 digits of the spore test number for the current week. Indicator strips do not verify sterilization of equipment. However, they do indicate that steam from the autoclave penetrated to the inside of each package. Every autoclave load must contain an integrator in order to prove that all parameters of sterilization are met. The following information must be written on each integrator before the autoclave is started. A. Time the load is run. B. Date the load is run. C. The last 4 digits of the spore test number for the current week. D. Initials of the person running the load. The integrator must be packaged face up, tapered end towards the sealed end of the package, in a 2 1/4 by 2 3/4 self-sealing pouch prior to being placed in the autoclave. Biological monitoring. Biological monitoring, commonly referred to as spore tests, are the only true method of determining the success of the sterilization process. A spore test is a control-based test in which a live sample of bacterial spores are placed in an autoclave and processed. Manufacturer instructions will indicate proper use of the test. The processed spore sample is sent to an authorized laboratory where it is cultured or incubated along with the control sample. Total destruction of spores indicates success of the sterilization process. The most common recommendation is to spore test a minimum of once a month. However, for higher volume studios, weekly testing is highly recommended. The spore test should be run in the same load as piercing and/or tattoo needles, as these are the most invasive pieces of equipment used in our procedures. Policy and procedure for operating autoclaves. To ensure proper sterilization of equipment and to preserve the longevity of the autoclave, always follow the manufacturer's instructions for the specific make and model of autoclave you are using. To ensure proper sterilization of equipment, do not overload the autoclave. Overloading can lead to ineffective steam circulation and penetration, which can result in substandard sterilization. Overloading can also lead to a longer drying cycle. All packages should be placed on the autoclave trays with the paper side of the package facing up. Autoclave cleaning and maintenance. In order to ensure proper function of the autoclave, as well as prolong the longevity of the machine, weekly cleaning, in addition to daily maintenance, is essential. The autoclave should be cleaned according to the manufacturer's instructions. Equipment storage. The method of handling and storing sterilized items must be done in a manner that ensures sterilized items are not contaminated. Where, how, and why sterile instruments and supplies are stored is important in achieving the ultimate goal of maintaining sterility up to the time the items are used. Conditions which can adversely affect the ability of a package to maintain sterility until it is used include moisture and other liquid fluid contamination, dirt, dust, and debris, physical damage to the package such as tears, punctures, broken seals, or breakdown of packaging, handling sterile packages with bare hands. Storage environment should be clean, dry, and easily accessible. Stored items should be arranged so that packages are not crushed, bent, or compressed. Sterile packages should never be handled with bare hands.